broadcast now. So.
All right. Thank you, sir. We'll call this meeting to order then. Roll call.
So Julie McCardle, present. Karen Bethany, here. Jim Fee,
Here.
David Creighton,
Absent, excused.
Michael Kinley.
Here.
Chanel McKinley. Here. Timothy O'Connor.
Here. Okay, moving on. We're gonna canvass the election. Chief election judge recommendation. Question ballots and approved.
Mr. Mayor, Council, I want to introduce Ashley Knock. Ashley has worked, this is her second year working the municipal election. And as Karen Coffey is kind of stepping back after being the head election official for most of our elections for the last 16 years, Ashley volunteered this year to be the head election official for our municipal election. And she'll also be leading the general election here in November. So, Ashley, anything you want to say? Okay. I told you guys are a nice crowd, so
I know,
don't make a lie around me. It's okay.
Okay.
Did
Mr. Mayor,
we'll just
just
jump
want,
into
it's necessary for the clerk and I to open the ballot, so if the council wants to stand at ease, we'll get our, and we'll try to start to get busy, okay?
Everybody will be except for Hannah, because she missed the election.
Don't worry about it. Don't worry about it at all.
I didn't have my phone. I was wondering.
Mel had a list.
I know that her as well.
So while these guys are opening the ballots, I'll just let you kind of fill you in on the elections. So we had 164 ballots that were cast at the polling place on election day. We had 7 absentee by mail ballots that were sent out and returned. We didn't have any absentee by mail ballots that didn't make it back this year, which is nice. We had 4 individuals on voting day who couldn't make it to the polls. And so they sent a representative to take them a ballot. So we had 4 folks vote by representative. And we had 37 voters vote in person absentee leading up to the election. So overall, we had 212 votes that were cast in the election this year. Not a huge number, but a respectable number, especially considering the COVID conditions and everything else going on. The polling place this year for both the primary election and the municipal election, and then again in November for the general election, was at Craig City Gym to give the voting officials a little bit more room to space people out, and it worked really well. So all of the election officials did a good job. As you guys probably read in your memos, we had, as you know, we had 1 candidate for 2 council seats. And so there's enough, the write-ins are particularly important this year. We had 1 write-in candidate who got a significant number of votes. And then we had about 20 other write-in candidates that got anywhere from 1 to 4 votes. For the 1 write-in candidate, which was Millie Coonover, who got a number of votes, each variation of the name or variation of the spelling, and there's a list in the memo in your packet. The election officials the night of the election worked through and talked through every variation as it came up. And then once the election judges had kind of accepted a particular variation of the name, then they accepted that variation throughout the rest of the votes as the votes were open. So the election officials have already talked about voter intent and whether or not those several variations the election officials felt that they met the voter intent, but we wanted to include those if the council had any questions about any of those. And wanted to talk, Ashley and I are both election judges, and so we're certainly open if the council has any comments or questions about those variations or kind of the discussion process. I can't tell you the thought process, because there were several other judges, but I can certainly share the conversation process with you if you have any questions about how that was done or the deliberation that went on by the election judges. Excellent. So as you also probably know from the memo, when we count the votes tonight, the Craig Municipal Code requires that a candidate receive at least 40% of the votes cast for a seat in order to be eligible. And since council doesn't have any objections on the variations of the names, depending on how the votes come out, it is likely that Millie will have enough write-in votes to meet the 40% threshold. Of course, we'll see after the ballots are open. We have a total of 44 ballots that are being opened. And so, or 48 ballots, I'm sorry, 48 ballots that are being opened and counted. A little bit more this year, so we'll take a few more minutes. Any questions about the election? We will start absentee voting for the general election here at City Hall on October 20th. And the absentee voting for the general election will be open here at City Hall from October 20th through close of business on November 2nd. And of course, the general election will be held at Craig City Gym on November 3rd. And that will thankfully end our election season for this year. 3 elections, just getting a new clerk in and everything else going on this year has been fun and a challenge. And I really ask, if you run into Karen Coffey, Joan Morgie, Evelyn Wilburn, you run into Ashley, run around, especially Ashley, please thank the judges. And the elections have done very well this year, and it really has been a matter of those election workers and election judges. So if you see those folks, please thank them.
Ballots in here.
There should be ballots.
Yep.
Yeah, there is. So it's not opening on his Dropbox, so. Well, you know what's easier is, I don't think I have the internet. It should pop right now. It does. I forgot the internet. It's different.
Okay, we're ready to proceed with calling out your ballots now. If any of the council members want to probably keep track, we have some extra copies.
If anybody wants to volunteer, go on, at least 2 folks.
Not the first one.
Oh, you do.
Michael.
Thanks, Mike. Thanks, Chanel.
Okay, Tracy, please begin.
Can I, real quick? So for the folks that are tallying, generally it helps that we don't lose count. You're gonna mark one hash mark for each vote that's called out for a candidate. When you get to the fifth one and you make a cross mark, please just say out loud mark or check or something so that all of the talliers know that they're in the same place at the same time.
Ready?
Okay. City council member, Julie McDonald. School board member, Kristen Durrell. On proposition one, yes. For city council. I have I have two different write-ins on each.
Okay,
What- Can you look at this one? There's two write-ins
all right, so there are two write-ins.
and two,
One is to really swim over and then there's another candidate as well. So, when you the judges.
just do it. Yeah.
Yeah, so normally in most elections, we count write-ins just as write-ins, and we don't call out individual names. In this case, we do have one candidate that has enough votes to potentially be seated, so we are calling out her name. But all the other write-ins tonight will call out as others. And then if we do have to have a runoff election, if Millie doesn't reach 40%, then we'll go back through the write-ins and we'll find the next write-ins. So it will be Millie and other write-ins is what we call out for that ballot.
Okay, so for the city council member, Millie Schoonover and Kim, or, sorry, other.
Okay.
And, then we have this as well.
Yeah, I think it's a big.
Okay, so then we have one for Marla and one for Tristan Duga. Okay, and proposition one is no. City council member. So, we have Julie McDonald and one for Millie Schumer. For the school board, we have one for Margaret McDonald and one for Kristen Janelle. And proposition one is no. City council member Julie McDonald. School board member Margaret Gillian. Daniel Nelson. Proposition one is no. City council, Millie Schumer. School board, Tristan Duval. Proposition one, no. City council, Julie McDonald. School board member, Daniel Nelson. One for Tristan Duval.
Check.
Proposition one is a yes. City council member, Millie Schumer. School board member is Marla Gilman, and one for Tristan Duval. Proposition one is a no.
Check.
City council member, Millie Schumer.
Check.
School board member, Marla Gilman.
Check.
Tristan Duval. And proposition one is yes. City council member, Julie McDonald.
Check.
School board, Margaret Gilman. One for Daniel Nelson. Proposition one is no. City council member, Millie Schoonover. and then other. School board is one for Margaret Gomez, one for Kristen Duval. Proposition 1 is yes. City council member, Alberta Valley Schoonever. Other, Barbara Stanley, other. Marley Gomez for the school board and one for Tristan Duval. Proposition 1 is no. City council member, Millie Schoonover. And one write-in, other. School board is Marley Gomez. And one for Tristan Duval.
Check.
Proposition 1, no. City council member, Julie McDonald. School board member, one for Daniel Nelson, one for Tristan Duval. Proposition 1 is no. City council member, Julie McDonald. School board is one for Margaret Gomez, one for Daniel Nelson.
Check.
And proposition 1 is no.
Check.
City council member, Julie McDonald. School board member, one for Daniel Nelson, one for Tristan Duval. Proposition 1 is no. City council member, Julie McDonald. And a write-in of Millie Schoonover. School board member, one for Marley Gomez, one for Tristan Duval. Proposition 1 is no. City council member, Julie McDonald. Write-in Millie Schoonover.
Check.
School board member, one for Daniel Nelson, one for Tristan Duval. Proposition 1 is no. City council member, Millie Schoonover, one for Margaret Gomez, one for Tristan Duval.
Check.
Nothing on top 1. City council member, Julie McDonald. School board member, one for Daniel Nelson, one for Tristan Duval. Proposition 1, no. City council member, Julie McDonald. School board member, one for Daniel Nelson. Top 1 is a no.
Month.
City council member, Julie McDonald. School board member, one for Daniel Nelson.
Check.
Top 1 is no. City council member, Millie Schoonover, and one other.
Mark.
School board is one for Marley Gomez and one for Tristan Duval. Proposition 1 is a no. City council member, Julie McDonald. School board is one for Daniel Nelson and one for Tristan Duval.
Who's the council member?
That was Julie McDonald.
So we should have, we should be at 14 for Julie.
And proposition 1 was no, or yes, I'm sorry.
Mark.
There we go.
So I was thinking of Julie, or I was thinking of this council, and I missed, we just redo that one for me.
You mean the tally total or just the last ballot?
Just the last ballot.
The last ballot is city council member Julie McDonald and school board member Daniel Nelson and one for Tristan Duval. And proposition 1 is yes.
With proposition one. Is that five?
City Council Member Julie McDonald,
Check.
Lauren Stevens, okay. School Board Member Marla Gilman, and one for Tristan DeBelle. Proposition one is a yes. City Council Member Julie McDonald, one other write-in. School Board Member is Marla Gilman,
Check.
and another write-in. Proposition one is a yes. City Council Member Julie McDonald. School Board Member is one for Marla Gilman, one for Daniel Nelson. Proposition one is a yes. City Council Member is Millie Schoonover. School Board Member Marla Gilman and Tristan DeBelle.
Check.
And proposition one is a no. City Council Member Julie McDonald. School Board Member Tristan DeVille. Proposition one is a no. City Council Member Julie McDonald. School Board Member Daniel Nelson and Tristan DeVille. Proposition one is a no.
Check.
City Council Member Julie McDonald. School Board Member Marla Gilman and one for Tristan DeVille. Proposition number one is a no. City Council Member is Julie McDonald. School Board Member is Daniel Nelson and Tristan DeVille. Proposition one is a yes. City Council Member is Julie McDonald. School Board Member is Daniel Nelson.
Check.
Proposition one is a yes.
Check.
City Council Member Lauren Stevens.
Check.
School Board Member Tristan DeVille.
Check.
Proposition one is a yes. City Council Member, nothing, okay, sorry. School Board Member is Daniel Nelson. And proposition one is a no. City Council Member Julie McDonald. School Board Member, one for Marla Gilman, one for Daniel Nelson. Nothing for Prop one. No council member, school board member would be Marla Gilman.
Check.
Proposition one is a no. City council member Julie McDonald. School board member Daniel Nelson. And nothing on proposition one.
But there's a write-in marked, but no names, there's no intent by the voter to write in a vote.
City council. City council member Julie McDonald.
Sure.
School board member Daniel Nelson. Proposition one is a yes. City council member Julie McDonald. School board member Marla Gilman. And one for Daniel Nelson.
Check.
Proposition one is a yes. City council member Millie Schoonover. And one other write-in. school board member is one for Marla Gilman, one for Tristan Duvall. Proposition 1 is a no. City council member Miller Schoonover, school board member, one for Marla Gilman, one for Tristan Duvall. Proposition 1 is a no.
Yeah.
City council member Julie McDonald, one for Miller Schoonover. School board member is Marla Gilman, one for Tristan Duvall. Proposition 1 is a yes. City council member Julie McDonald, one for Miller Schoonover, one for Marla Gilman,
Mark.
one for Tristan Duvall. Proposition 1 is a yes.
Mark.
City council member is other write-in. School board member, one for Marla Gilman, one for Daniel Nelson. Proposition 1 is a no. City council member Julie McDonald, one for Miller Schoonover.
Mark.
School board member, one for Daniel Nelson, one for Tristan Duvall.
Right.
Proposition 1 is a yes. City council member Julie McDonald.
Sure.
School board member, one for Marla Gilman, one for Tristan Duvall. Proposition 1 is a yes. City council member Julie McDonald. School board member Marla Gilman, one for Daniel Nelson. Proposition 1 is a yes. City council member Julie McDonald. School board member Tristan Duvall, one for Daniel Nelson. And proposition 1 is a no. And that concludes the votes.
So we'll read the totals, John, at the right end of the votes. Has everyone got a total?
Yes.
Okay, so I'll read these out, please let me know if your totals are different. So for Julie McDonald, there's a total of 160 votes. For write-in Millie Schoonover, there's a total of 91 votes. For write-in other, there's a total of 38 votes. For Marla Dillman for school board, there's a total of 144 votes. For Daniel Nelson for school board, a total of 109 votes. Kristen Duville for school board, a total of 119 votes. And there are a total of 3 write-in votes for school board. Proposition one, there are 62 yes votes and 144 no votes. Let me add up, so, let me add this up real quick. Plus 38. So 289 votes, cast for the 2 council seats. 24, 256, divided by 2, because there are 2 seats, 57.8. The 40% threshold is 57.8. So the write-in will needs 58 votes, excuse me, in order to meet the 40% threshold, which Millie meets. The current winners of the election, Julie McDonald and Millie Schoonover for City Council, Marla Dillman and Tristan Duville for school board, and Proposition 1 fails.
At this point, Mr. Mayor, council should consider a vote to certify the election.
We call the meeting back over. You guys have been- Accept the results. In second, to accept the results of the 2020 election. All in favor? Opposed? No. Thank you.
I'll second, or did you make a motion?
I am confident making a motion assuming you're done too. Okay, move to accept consent.
Second.
Motion's been made to accept the consent agenda.
I am stating conflict of interest with the consent agenda.
Okay. Do the whole consent agenda?
No, just with the creating of the new license transfer application.
Okay. Chanel's exempted herself from voting on that issue. So, motion's been made to accept the consent agenda. All in favor?
Aye.
Opposed? None. Let it show that Chanel exempted herself from voting on the carrying that liquor license. Okay, we're open for public comment from the public now. Is there any comment?
Mr. Mayor, we didn't have anybody email comments or ask to call in tonight.
Thank you. Okay, moving on. Reading correspondence. Anything that we need to bring up? If you have an update on the Crystal Lake cash refunding, the state is still looking into ways to fund it. So that's a key, pretty important issue for us, but that's where our second case on the money to run it comes from the sport fishery, fishing industry, the charter guys. They didn't have the industry, they didn't have the money to fund it. But they have to be funded. So, address the issue for it. Okay, anything else on that?
I'd like to make a comment on the second one, it's, the letter that was from the Alaska Bush Office regarding the halibut management. This has to do with the trawle bycatch in the Gulf of Alaska, Bering Sea. I am encouraged personally that this is getting much more attention. There's a number of entities, let's say, that are actually starting to put some real serious effort into addressing this issue and bringing pressure to bear and the North Pacific Fisheries Management Council. They were discussing today the road forward in terms of allowable bycatch for the trawl fleet of halibut. And there's significant pressure on them that it has to go to an abundance-based system. They've always done a gross number system, which has allowed them to retain or maintain a high bycatch rate, even if we have a falling stock, which is ludicrous. And 5 years ago, it was suggested to begin working towards an abundance-based approach, and they still have not done that. So, North Pacific Fishery Management Council meetings have been going on now the last week and a half, and there is a lot of pressure here on this issue. Basically, to get the trawlers into an abundance-based compliance system. Something I've been paying attention to and actually have listened up. I'm pleased to see this, and I think there may be an opportunity in the future for even communities to go in on this.
I've talked with Chris Tompkins and Sam about someone. Tompkins, he's active in this right now.
Yeah, he is a good letter writer too. So I'm encouraged by the attention that this issue is starting to get. I mean, it's, when you really dig into it and look at it, it's almost inconceivable that a fishery with this much waste can be being conducted in the United States. It's just all.
It'll destroy the industry here if we don't get it stopped. It did in California, in Washington, and Oregon, they wiped it out. That's wrong.
Anyways, I'm glad to see that in there. I'm paying attention to this closely, and I hope to see much more pressure.
Are they still saying a comment on this?
No, comments in it last week, I got them, a few other people in town did.
I was thinking citywide.
Yeah.
Their bycatch is higher than our annual catch here in the southeast. 2C area on the halibut line. They throw away more halibut than we are allowed to catch. They're allowed to trawl right through a nursery up there, we are allowed to long. Yet they allow them to trawl right through it. It's crazy.
Depending on the amount of the sandwich you're throwing out.
pledge. Any more comments on this? Moving on. Unfinished business. CARES Act, electrical utility facility.
Mr. Mayor, the council, a couple of meetings ago approved $50,000 working with AT&T to provide some electrical credit assistance to Craig residents. We've got a total of 156 applications and have sorted through those for eligible applications. We recently applied a payment of $150 per account to the eligible accounts. That used up between that and administrative costs. We're at about half of the $50,000. I made a couple of suggestions on how we best proceed, and one of those is that we will likely go back out in November or December with a second credit to folks that are eligible. We will probably also open it back up to a short application period. We shortened the application period to start with quite a bit, and we have had about a half dozen people who were traveling or for whatever reason didn't get their mail within the application period. And so we're likely to open a second short application period and then revisit the total in November or December and make a second credit to all of those accounts. So there's a recommendation on the bottom of the memo. I'm looking for some direction from the council to proceed kind of how we have outlined the use of the remainder of that $50,000 for electrical relief. Be happy to answer any questions.
CARES Act rental mortgage assistance.
If it's possible, if the council could move to direct staff to proceed with the electrical program.
Make a motion to direct staff to provide electrical utilities.
Motion's been made to in-depth electrical utility really bad. Need to vote on that?
So just to clarify, you're talking about, doing an additional 150 for this 131, possibly 156, plus anybody new that gets gathered?
And the actual dollar amount will vary depending on how many
Yeah, if you're divided.
applicants.
Okay. Right, just want to clarify.
Okay. All in favor of accepting that? Opposed? CARES Act rental and mortgage assistance.
So in the long list of programs that we've talked about over the last several months, we talked about providing some rental and mortgage assistance to Craig residents. And so this is the program based on the research that was done. There's an application form, some program guidance, and a certification form that landlords will have to fill out. Jim mentioned in a conversation last week that he would like to have seen some stronger language on the certification section. So I put in front of your places tonight just a little short sheet, and there's a couple of minor tweaks to it, but the language potentially would read, as an official signer of the application, I certify that the information provided in this application is true and accurate, and that I meet the eligibility requirements for this grant. I agree to assist in verification of information provided in this application and to provide additional information to the city of Craig if requested. Furthermore, I understand providing a written false statement, which I do not believe to be true, is a B misdemeanor and is punishable as perjury. I had an extra word 2 in there, and As Jim pointed out, in Alaska, they're A and B misdemeanors, not third degree, so I made that change. But essentially, this is calling out to the applicants that falsely certifying the application is a criminal offense. In my memo, I've recommended to the council that we start with an appropriation of $100,000 of CARES money and advertise the program and make payments based on the number of applicants.
Are you advertising on the City of Craig website?
And Facebook, and we'll put out some flyers. And Misty Fitzpatrick, who's been doing a lot of the CARES work for me, has been regularly putting out postcards to Craig post office box holders. And so it's likely that we'll put out a postcard specifically for this program. In fact, it's already generated a lot of interest. We've gotten a number of phone calls for folks that are already looking for information.
No, I think Thursday.
Oh, yeah, right, yeah. Yeah, this was one of the items scheduled to have been talked about.
I'll go ahead and move to approve $100,000 in CARES Act funding to provide rental/mortgage assistance to Craig Hospital based on eligibility and application criteria presented by staff and approved by the council.
Motion's been made to approve the CARES Act rental and mortgage assistance plan. Any discussion on that?
I'd just like to say, I've been hesitant on this program simply because it's not something that the city of Craig normally does, and I just was worried about, we approved this person, but then we missed this person, and I just felt like we might be getting ourselves into a lot of trouble, but looking at what, they put together, they've done a really good job of spelling it out, answering questions, thinking through the program. And that's not it, my concerns were not knocking the city of Craig, it's just something brand new. So anyways, I think they've done a really good job with the documentation. I think we feel like a lot of the issues have been thought through. I love Jim's suggestion. You know, I don't think it's too much to ask. We're gonna give you money, can you just be honest? So I really like that we've got that language in there. And so that was my only comment.
Okay, there's no more further discussion, I guess we'll vote on that. All in favor of accepting the $100,000 for the CARES mortgage and rental assistance? Opposed? None.
Thank you, council.
Passed. Declaration of economic disaster discussion.
Mr. Mayor, as an inquiry for the council to ask if you want to join in with the communities and publicly seeking a disaster declaration due to the commercial efficiency. And if the council decides it's what it wants to do, then you can decide whether or not it wants to prepare a letter or a resolution.
Everybody's aware of our disaster efficiency. Everybody else opposed? The rest of it on bars that didn't get any Christmas in there. Drunk or otherwise.
They're open anyways.
So, do you have any discussion on this? Anybody to have John prepare a letter for go in with Petersburg, Wrangell, and Ketchikan on this?
Yeah.
Yeah. That direction you want to vote on?
Do you have a preference between format, whether it's a letter or resolution?
You think that's more power?
Resolutions typically.
Would you do resolution for that?
I don't know, that's more power. It's a little more formal.
Right.
We can send a letter with the resolution.
Sure, it's all-
Take one.
So resolution at the next meeting?
Yes.
Thank you. business considering air medevac sponsorship? John, where are we at on that?
Memorandum in the packet summarizes the response we got from the solicitation sent to the three primary medevac providers in Prince Wales. You can see there was one response, the other two didn't provide, didn't participate because their bylaws or organizational structure, what have you, doesn't permit them to offer this memberships to individuals without medical insurance. And would have been too heavy a lift for them to reorganize themselves in order to meet the requirements the city set forward in the solicitation that the memberships be provided at no cost to the community residents. So that's why we ended up with just a single proposal, and that's from Guardian. That proposal is $100 per household, which is a reduction from the sort of the retail rate of $125. You can see I expressed some ambivalence about, I guess there's some pros and cons to Guardian's proposal. I'm anxious to hear council input on it. If it has a preference between the three options I've laid out. Stand ready to respond to the direction. I mean, in some respects, I'd rather run it like we did the mortgage or the electrical program. Even though it's a little bit more effort, it also would draw a response from individuals that actually overtly express a need for it. And the flip side is Guardian did respond. They did the effort to do it. It's easy to administer. It would be virtually no paperwork to implement it from Guardian's standpoint, but it still is $47,000.
Flight service was the one that wrote to us about assistance.
That was North Carolina Northwest.
And they didn't respond.
They told me they could not because of the way they're structured, and that they can only offer memberships to people with third-party insurance.
Why did they suggest that then to us? Oh, they were asking for.
They were asking for an outright donation. The council decided they would rather see some more tangible benefit to the resident for this membership issue. In that way, area ambulance service will get some funding, and in return, the city residents will get a tangible benefit.
One of my thoughts on option one is, isn't there the possibility of double coverage? Like people already having it,
Yes.
and then we're buying it a second time?
We have the thing you talk about where you fill out a request.
Option.
But that would be option two.
Oh, I see.
Option one,
Option one will double up some people.
I like the option one option because then it's just universal, everybody's covered. But yeah, it seems wasteful if people already have it.
I have.
Yeah,
The thing is, can we talk to them and the other people get extended from the end of
Yeah.
their contract so that they get
There
a
you
year
go.
beyond their,
Or
what they've already paid for?
what's the remainder of
Yeah.
their?
So let's say I have 6 months left, they would give me a year and 6 months. And then the administrative burden falls on them.
Yeah, that would be a great thing to ask,
I like that.
because then we're still getting every household that year.
Yeah, and we're not wasting a lot of money on administrative.
If they have to do that, my suggestion, my thought is they'll come back with higher prices, my guess. But I can put the question.
And again, the people have already paid their
Yeah,
$195.
And it's a pretty big chunk.
But they're offering us a discount. And I don't know what they'll do, but I'm happy to get that back.
Let's see about that. The administrative burden shouldn't be too high on them. I mean, they already have in the computer, McDonald household, and they just add a year to whatever's left. So I wouldn't think it'd be that big of an administrative burden. And I'm sure right now they could use a shot of money, so that might motivate them.
Okay. here, they go back.
So it's only savings of $9,750.
If we save that much,
If
we
we don't,
donate it to, Northwest, weren't they like, through the University of Washington? That's why they were approaching us with donation.
Yes, they made a contention that they were eligible for, like some nonprofits are, because of their connection to the University of Washington.
How much were they asking for?
Any contribution, airlift,
Yeah.
they were asking, they were hoping to raise $2 million, I think, the dollar amount to keep one of their 3 aircraft here through the end of the year for an additional 12 months. My recollection.
And they were hurt by COVID?
Yes, they said that there are a number of flights that they typically get called for about by 3rd or at least 10th of March.
right,
And never causes less.
Well, on our call volume dropped, anybody call volume on that, just dropped it nothing compared to what's prior to the COVID year. It would follow that their services all dropped as much. So, yeah, with our call volume was a third less than, or a third of what they were.
Another point that I'll have to follow up on is that the benefits derived from this CARES money need to begin this calendar year by December 30th. If someone has a membership that already kicks them into 2021, we may technically be in non-compliance with that particular criteria.
No, that's why we're asking that they start their city one now,
right,
but you add on whatever was remaining to the end.
right.
We have to make that clear in some
Yeah,
documentation.
right.
So there's city one, instead of double covering it, the city
Just
one
kind of like
starts now.
suspend everybody's accounts that are paid, because the
Yeah.
remainder when it's the year's over.
Now,
City
how the
funds,
city's gonna really know if they did that?
Mhm.
You know what I mean?
if people pay attention.
Yeah, or if you have the individuals to pay attention.
Right.
'Cause, I mean, we sitting here, I have no idea what's left in mine. I know I paid for it every year, but anyway, individuals. At least we're not knowingly double paying. That
I
just gives me
would
an
like
idea.
to know if that's an option.
And we've got a meeting next week. You think that's manageable, John?
Yeah, actually, I'm talking to my contact regarding tomorrow.
Okay, perfect. So we'll bring it back next Thursday. Okay, ready to go on the mammogram? Oh.
Yeah.
I need to, okay. Getting bigger, I can't see. There we go.
And we have a clear on the medevac thing,
Yes,
consider sponsorship of Craig Seat things.
Mr. Mayor, there's a memorandum in the packet. Recommendation is to direct staff to prepare the documents to transfer the official sponsorship designation. If there are questions, I can have it.
And move to authorize staff to prepare documents with the city to assume FAA sponsorship of the Craig Seaplane names.
Second,
Motion's been made with, prepare the documentation to accept the seaplane base, take it over to the city of Craig. Any discussion? All in favor of that?
Aye.
Opposed? Okay.
as we're accepting this, then will will the timeline still allow us to qualify for the $20,000
Yes.
support? Well, the reason we're doing this is because there's a $20,000
Unpaid,
available,
the federal funds.
and because we weren't the sponsor, we were qualified by taking over the sponsorship, but we still end up being eligible for this.
Oh, okay.
We talked specifically with DOT staff about that. It's kind of a critical piece of the puzzle.
CARES Act mammogram assistance program.
Mr. Mayor, one of the results of COVID-19 is the mobile mammogram unit is not traveling Southeast Alaska this year. We've been in discussions with the Peace Health Foundation about providing funding for Craig residents who are not able to get their mammograms because the mobile mammogram unit was not traveling. We're working with them to pay travel back and forth to Ketchikan so they can get their mammograms done. There might be one or two patients from Search. I've talked to Search a little bit about the same subject. There is likely one or two patients that kind of fall into in between their various programs that are already funded. And we've talked about how to take care of those patients as well. I know the ferry's not running right now. Peace Health had originally asked for about $10,000 based on what is probably a high number, given the fact that there's only 3 months left of the year in order to do these mammograms. I have a meeting with Misha Chernik from the Peace Health Foundation tomorrow morning, and I plan to talk to her about how many mammograms they're really going to be able to schedule and get done before the end of the year, talk about the problems with the ferry shutdown right now, and try to resolve some of those issues. I'm suggesting that the council appropriate up to $28,000 for this purpose, and the exact number will kind of depend in part on those conversations with Misha tomorrow.
Question for you. When they canceled the program 2 or 4 months ago, there were people who had to have mammograms that went over. Is there going to be some way that Peace Health is going to know who came over? Is there some way to help those people out to spend their own money to get there too?
I don't know the answer, but I'm happy to talk to Misha tomorrow.
They'll have a list of who's already paid their money over there. So.
Technically, we can use the CARES funds retroactively back to March 1st. So
Yeah.
I'll talk to Misha tomorrow about that and find out if there's a way we can identify those folks, and I'd probably likely identify uninsured portions of their travel and make some effort to make them whole.
Yeah. My rough estimate would be that probably need between 35 and 50 women from March until December. That will probably fall into meeting this. I don't see it reaching the 20,000 mark, but we already talked about what happens with that, so.
If the ferry doesn't reach their date of back up and running, have you guys thought of chartering boats or anything for the mammogram?
Yeah, that's certainly one of the things we'll discuss probably more than just tomorrow, is how to move forward between scheduled airlines and charter either flights or boat service or some other alternatives.
Yeah, I know the Craig volleyball team chartered a boat and it went there and back in the same day for them. And it was enclosed and.
I'll move to approve the use of 20,000 in CARES Act funding to provide travel assistance to Peace Health for Craig residents traveling to receive mammograms. One other thought, you mentioned that there's going to be, I'm sure there's going to be 1 or 2, or maybe up to 5, I don't know, of the Search patients. So is that going to be another thing you bring to us, or?
No, likely we'll take care of that through the money that's already been appropriated to Power.
Okay, all right. I see. clarify it's for travel between March and December, from March to January 1? Or does it matter?
I don't think that matters. Those are the ground rules of the CARES money. So.
Okay, so it's redundant, okay.
So the motion's been made to approve $20,000 for the mammogram assistance program. Much further discussion, we'll call for a vote on that. All in favor? Opposed? None.
Thank you, council. If you see Missy Fitzpatrick around, and she's in the office most days right now, please give her the rent mortgage program, the electric relief program, working on this mammogram program. Plus, I've got about 10 other irons in the fire that she really is doing the lion's share of the work. And she's doing, I'll echo what Julie said, the credit really goes to Misty much more than to me on the status of the rental program and some of these others. So if you see Misty, please just give her a big thank you.
We'll bring that up the next meeting.
She's actually working.
Oh!
That's a nice girl. Hey, Craig PD water heater replacement.
Mr. Mayor, this item is now actually mostly completed. We have to get that because new hot water in the building. The actual cost is around $2,200. Not 36.
Move to appropriate $2,200 to replace the water heater at the Craig Police Department. Cool, and unusual. Another
It
lawsuit.
is a
I think you're there.
constitutional lawsuit.
Yeah, cold water is fine.
We don't need a TV dinner, that's on electric.
Is that an official motion?
Yes.
All right. I second.
Motion's been made to approve the $2,200 to pay for the on-demand hot water heater for the PD. Any more discussion on that?
Just to clarify, you said it's mostly done at 2,200. Do we anticipate a few more dollars?
No, that should be fine. And if it is, a few more, we can transfer money to different line items.
Yes, all in favor?
Aye.
Opposed? None. We need to appoint the city clerk or something.
Yes, please.
We did. We did.
I like it so much, I would talk Tracy.
There you go. Yeah, she can get the element whatsoever.
Move to confirm the appointment of Tracy Jensen to the position of city clerk. Second.
Motion's been made to appoint Tracy as the new city clerk. All in favor of that?
Aye.
Opposed? Wow. Unanimous. Now
You
now you're
thought you could get out of it, didn't you? I'll talk to you in a couple minutes.
All right, we're gonna review the policy, COVID, interesting. 19, gym policy.
So this is something that I had asked for. I didn't ask for OCO. This is something that I had asked to review. Basically, at this point, the main usage is for running. I am by no means an expert on martial arts. I don't know anything about them, but my son is in martial arts, and I am a healthcare provider on the island. And so let me first start by saying, just in general, the karate, how blown away I have been by having that here on the island. It's an incredible resource, dedicated group of individuals. They take what they do very seriously. It's a really valuable resource for us to have. It's been around for a while. And I've been going regularly with my son, and they are following all the rules to a T. So I have a lot of respect for this group as a whole. But as I'm sitting there in the gym with my mask on watching this, what happens currently is all the kids arrive with their mask on, which I support. They get screened, they ask the questions, have you traveled, have you been sick, they take their temperature. Once all that occurs, they go out to their marks. So in the gym floor is tape that says karate. They're all 10 foot and 10 foot from one another. They then proceed to do the martial arts thing. Again, this is where I'm not. Whatever you call it, they do their thing. They're not sparring right now. I think it's called sparring, whatever. They're not contacting one another. They're just in their individual spots. So they do that for about an hour, and then they do their bow, say their goodbye, and then another group goes another hour. So, but I'm sitting there watching this, and I'm just wondering why once, again, I know COVID is serious. I am 100% for masks. I'm 100% for screening. I'm 100% for them being 10 feet apart right now with what's going on. But I just don't really understand the need for the masks once they're on their mark in their position. I'm watching people that normally can do these moves and this activity easily are struggling. I know some various health conditions in there, and I'm just sitting there back, and then I'm watching my son, and I have trained my children. Now, my 3-year-old not so much, but my 5-year-old and my 8-year-old, if they're going to go to trouble to wear a mask, they're doing it properly. So they know how to put the mask on, only touch the loops, bend the nose and don't touch it again. But I'm watching my son, he's grabbing it and pulling it out so he can breathe. It's sliding off of his nose. We get out to the car, and we don't do the whole take the mask off, shove it in your pocket, because that's the entire purpose of wearing it. Like, my kids know to take it off and hand me my beer hold, and I hang it up in the car. He hands that thing to me, and I'm like, oh, it is moist from the condensation and the sweat, and I'm like, this one's going in the trash can, we are not wearing that one again. So I've just been kind of sitting there as a spectator, just wondering if it's really necessary. The only potential risk that I can see of not wearing a mask once they're on their mark would be if you had it asymptomatic, because if they have symptoms, they're not going to the door. Community spread, because if they travel, they're not coming in the door. So you'd have to have an asymptomatic community spread case that expelled the respiratory droplets over 10 foot. And I just feel like the risk of that is pretty small. And the detriment of having to wear them, I did, Victoria sent me from October 9th, DHSS for Alaska, they had sent out, and they very clearly say in here that they want people to wear masks at all times. None specifically mentioned martial arts or karate, but they are very clear in here that they want people wearing masks all the time. They do note that the Alaska School District has not reported any cases of COVID from one team member to another, but they do endorse mask wearing during all exercise. But then I went to the CDC, and on September 11th, they say, wear a mask when interacting with other people to minimize the risk of transmitting the virus. This is specific to gyms and fitness centers. They say wearing a mask is most important when physical distancing is difficult and when exercise type and intensity allows. Consider doing vigorous intensity exercise outside when possible. And stay at least 6 feet away from other participants, trainers, and clients. So we're doing 10 feet. In here, it reads to me that you're wearing a mask when you can't distance. The World Health Organization, this is on their website as of yesterday, says people should, and in all caps, not wear a mask when exercising. As masks may reduce the ability to breathe comfortably. Sweat can make the mask become wet more quickly, which makes it difficult to breathe and promotes growth of microorganisms. And they say stay a meter apart, which we're exceeding. The American Council on Exercise on 7/19 of 20 says to wear face covering in public settings where social distancing measures are difficult to maintain. And then it says stay at least 6 feet away from trainers, other clients. In the Parenting magazine, they interviewed different doctors, and they said, while exercise is key to maintaining good health, adding a mask presents a safety concern. Mask tolerance is a bigger issue than people realize. It goes on about the wet mask thing and that they can be less effective. Then it goes on to say wearing a mask can make people fatigue faster than normal. And then they go on to talk specifically about kids, that little kids are not as aware of their bodily functions. They might keep exercising despite physical warnings, possibly leading to negative consequences. So I went to a medical journal from the Department of Exercise and Sports Medicine located in India. This was from June 22 of 2020. They say exercising with face masks may reduce available oxygen and increase air trapping, preventing substantial carbon dioxide exchange. This can potentially increase acidic environment, cardiac overload, anaerobic metabolism, and renal overload, which may substantially aggravate the underlying pathology of established chronic diseases. We recommend that social distancing is better than face masks during exercise. It gives an in-depth dissertation about how it affects the heart, but there are some concerns with people with cardiac issues with wearing masks. And then last but not least, the International Health Racquet and Sports Club Association in August 20th says, while risk of having adverse effects related to exercising with masks is not well understood, there have been reports of side effects and even death. There's a couple of kids in China who think the death was resulted from wearing masks while not. So, COVID is very serious, and my concern, listening in on the school board, listening in the different public settings, the whole thing has become so ridiculously political. You got people screaming they'll never put a mask on their face. You got people screaming you should not leave your house without an NN5 properly secured. I feel like there's got to be a middle ground somewhere. And my other big concern is I feel like people have become so myopic on COVID that we're kind of losing sight of some of the bigger ramifications. And I have, for the last 11 years, been standing in that pharmacy serving the patients of Prince of Wales. And I love the people of this island, and I love my patients. And a little bit in June, but a lot in July, the number of people that were being treated, plus the treatments increasing for a couple of disease states, dramatically increased in July. I can tell you, depression, anxiety, substance abuse, and sleep disorders. The number of people and children that are now being treated or being treated heavier than previously really increased a lot in July. And I run into my little gymnastics kids in the grocery store, different places. When are we going to do gymnastics? And I'm like, wow, I can't do it. I can't figure out a way to do it safely. I have to sanitize. I'm trying to touch the equipment, but I just can't do it. But here we have an activity that promotes physical, mental, and emotional well-being. We have a very good group that's being really responsible, and I feel that making them wear masks once they're in their spot doing it is creating a hindrance, and even some people aren't participating because of it, and I think we should revisit that.
So I've made a recommendation, actually already, Julie, that we go back to, that we move to a policy of requiring masks upon entry and exit, and masks both for spectators and for participants when they can't maintain either 6 feet social distance when not exercising or 10 feet social distance when exercising. I will say, and Victoria has shared quite a bit of information, and I've been trying to follow a number of the statewide webinars and information from public health. Public health is finding, with more of the recent data, actually moving to a recommendation of wearing masks all the time. And they're actually finding a significant number of COVID-related both case clusters and mandatory quarantines, widespread quarantines based on athletic activities. And so they're moving more towards recommending mask wearing even while exercising. State public health is making that recommendation currently. I think based on the fact that we have no active cases currently, my recommendation is to go to strict social distancing and masks when the social distancing can't be maintained. But we'll probably come back and make a recommendation to go back to the current policy if we start to see cases locally. So that's the recommendation I've made. I don't think we've instituted the policy yet, but that's what we've been discussing internally.
I agree with Julia, I don't see why once there and then where it's reaching that 10 foot distance, they should still have to wear a mask when they're. And I like the policy that Brian put in place, that if we can't social distance, then masks are definitely required, but that if that social distance and they can stay in that area of being social distance, then I don't see why they should have to wear their mask, especially karate, because their moves are all precise and fluid. Where it was more like volleyball, where they start off distant, but then, of course, when the girls.
They all run to the ball.
Right, exactly.
What action do we require? You make policy changes.
Yes.
So when, because I was there today and it was still masked, did that go, when does that go into place?
I think we put this on the council agenda for last week, just to see if there was any other input from the council before we made it effective.
Oh,
But it sounds like that's the direction the council is interested in, so.
Yeah, that's what we're really coming to. The policy is not universally supported on the staff, but we need a policy. We hung our hat on state recommendations all along. But you're the council, you set policy, so ultimately, so, whatever direction you give us tonight, we'll go.
Does council support this policy change?
yes.
Yes, I have a question. Do, I know there are multiple doors in that building. I would recommend that there be a fan blowing air in one door and out the other during that time, so you had the air exchange even better, so that there was not immediate concentration.
You can't even use a hair dryer when you're getting hair done. The fan blows it, makes it go farther.
There are recommendations, the better ventilated an area is, the less risk there is of exposure, but
Or see, if
Putting
you had-
a-
If you had a fan clear back at that back door, it would not be, it would only be moving air, it would not be acting.
You can create positive ventilation without blowing it on the people that are there.
sure.
You do it in a fire, you control the fire.
Get an air purifier.
No, you just put a fan in. You can.
I have one in my office.
So yeah, it's a balance, but we can look at it between good ventilation and actually propelling air within the exercise area would be a bad effect, but better ventilation
Just
overall is a
just
good
make sure
one.
both doors are open.
Right.
I just think it would just add another,
Mhm.
because the concentration is what causes the problem. That's why when you're quarantined in a house with somebody who supposedly has COVID and nobody in that house catches it, it's kind of bizarre. We've had multiple cases here, supposedly of COVID, and no one in their whole households got, or the employees that were in a building together on a daily basis for 2 or 3 days didn't catch it. So it takes a pretty big concentration of this stuff to get you sick at times. But I think it would just be a good idea to have more air. If you don't want to use fans, or that would protect them and have both doors open.
Do we address the liquor license issue?
Under the consent agenda.
Do we bring it up again later?
Once it's through the consent agenda, it's through.
Okay. Just want to make sure we got it.
Unless you guys want to put it off and discuss it.
No. We refuse, we can't talk. Don't think that- Okay. Good with all that. Yeah, is there any council comment?
Yeah,
Yeah.
congratulations.
Thank you.
Marla and Kristen.
Tristan, Young.
Julie, congratulations.
Move to adjourn. Motion been made to adjourn. All in favor,